Do you want to introduce yourself or?
Okay, yeah.
Yeah?
So I'll say, hi, my name's Dr. Should I say Doctor?
Yeah.
Yeah. Hi, my name's Dr Maheswaran. I'm one of the GPs at High's GP practice, and I'll be answering some questions about depression today.
So, what is depression?
So everyone can have good and bad days, but clinically depression is defined as having low mood for more than 2 weeks. So other symptoms which are associated with depression include having low mood, low energy, and not doing the things that you usually do, like seeing your friends or doing your usual hobbies.
So, what other symptoms might people have?
So people who are depressed may have other symptoms. So that often they feel guilty, so guilty for something they may or may not have done, not seeing people, not fulfilling their duties that they sort of put on themselves. Often they can feel worthless, so they have very low self-esteem, and also hopeless, so very sort of poor outlook for the future.
So, what other parts of people's life might be affected?
So people who are depressed can also find that they have difficulty sleeping. So often they're able to get to sleep okay, but they wake in the middle of the night unable to get back to sleep. And this is very common of depression. It can affect their appetite, so they just don't want to eat, they don't feel hungry. And the other thing it can affect is their libido, so they can have very low libido.
What other things would you ask when you see someone that has depression?
So often people who are depressed feel very, very low, and when people feel like this, they can often, like I mentioned before, not have much hope for the future. They may have thoughts of self-harm and also thoughts of suicide or have tried to attempt suicide. So we always make sure that we ask and assess the risk, and if there is a risk there, then sort of forward them on to other professionals who can help.
What other conditions are linked to depression?
So whenever we see someone who we think may be depressed, we also make sure that we rule out other conditions. So there are other conditions like bipolar affective disorder. So in this condition, patients can feel very low for periods of time, but they can also feel very, very high. So we have to make sure that that's not the case, because that's treated separately as a completely different condition to depression. But there are also other sort of forms of depression where you can have a psychosis associated as well. So people can often hear things that aren't really there, and very occasionally see things that aren't really there. So there are other things that we have to check for.
How can someone manage their depression?
So the good news is that there's loads of things that you can do yourself to try and help manage depression. Often these are just things that we would advise in order to maintain a healthy lifestyle. So things like regular exercise, making sure you're eating healthily, seeing your friends, so seeing other people, and doing the things that you normally enjoy doing, doing your hobbies, stopping smoking and drinking alcohol. All those bad habits can help to help with your depressive symptoms.
And lastly, what other help can a GP offer?
So if you come to the GP, there are a few other things that we can offer other than sort of doing the lifestyle changes, which often makes a big difference. We can help with offering counselling or other talking therapies like CBT, which stands for Cognitive Behavioural Therapy. These are often done by the local mental health services or wellbeing services, and they're a really, really effective way of managing low mood. And often we find that this is one of the most effective things that helps long term with depression. The other thing that we can help with is with medication. So if you're finding that your symptoms are quite severe and they're impacting your day-to-day activities, and it's something you want to try, then there are antidepressant medications that we can help with. Often they're a short-term solution, which patients are on for a few years, but ultimately it's the talking therapies and the counselling which help longer term.
Great, thanks for your help today, Dr. Banuka.
Thanks.